We're going to have Timothy Jackson, and then Carmen's going to come up after him. We're going to have our two crucial conversations on self-care. Let me set you up properly, Timothy. And I had the pleasure of, you know how you see somebody at the meetings you go to, like the United States Conference on AIDS, and you keep seeing them, and I've had the pleasure this year of really just being able to say hi, really say hi and mean it. So, and he's a fantastic person. As you all know, here in Chicago, DC is a little bit behind you, but I caught up. So, as we prepare for this session is about taking what we've learned from our community discussions and linking it to self-care, both individual and collective. So, our first up will be Timothy Jackson. He's a Senior Director of Policy and Advocacy at AIDS Foundation of Chicago, and he's going to talk about something that's necessary. We talked about advocacy and policy, right? He's going to talk about the Illinois Long-Term Care Bill of Rights. Are you ready?
I'm ready.
Yes. Would you like the microphone or do you want to stand behind it?
Can you use this? Thank you so much, Ms. Vanessa, and thank you to the Reunion Project for allowing me to spend some time with you all today on this Saturday. And we're going to go on and get started. As Ms. Vanessa said, I'm Timothy Jackson, Senior Director of Policy and Advocacy for AIDS Foundation Chicago, where for the past 40 years we have worked at ending the syndemics of HIV and homelessness. We also have Pride Action Tank, which is a policy think tank that centers LGBTQ folks, as well as older adults living with HIV. And so those two together, as well as AFC, is one of 3 entities that lead the statewide plan to end the HIV epidemic, Getting to Zero Illinois. So I work in our policy team. It's about a team of 9, where we are constantly thinking what we can do to make the lives of our communities better. And obviously we do that through a policy and advocacy lens. And so before we get to talking about the Long-Term Care Bill of Rights, a few years ago, AARP of Illinois and SAGE put together a report called the Disrupting Disparities Report that looked at some challenges and solutions faced by LGBTQ plus Illinoisans ages 50 and older. And just as a part of that report, that group also includes older adults living with HIV. And in that report, listed a number of policy recommendations that we should consider implementing to make, again, the lives of our communities better. And some of those rank from getting data collection from state agencies on age, disability status, sexual orientation, gender identity, primary preferred language. Obviously, getting data is important to realize what disparities are, because without that data, you can't find the information you need to fix things, right? And so that's important. We looked at mandating LGBTQ plus cultural competency training for state-funded providers, which we were able to do. And again, that includes older adults living with HIV. And then another thing that we were able to do was to create an LGBTQ plus ombudsman of sorts to advocate for this community to the state, essentially. So making sure that we're centering communities and all of the work that goes on behalf of our communities. And so another policy recommendation was this: the LGBTQ plus HIV Long-Term Care Bill of Rights. What is a Bill of Rights? Bill of Rights is essentially a list of rights that our communities are owed, that they expect when they go into long-term care or home and community-based services. So think home health. Anytime that they are receiving services from the healthcare, social services sphere, these are the list of rights that they expect. And so this is legislation that we are right now working on to potentially run a bill in 2026, fingers crossed, but we're gonna talk about that today. So, as Dr. Barnes mentioned, LGBTQ elders and older people, age 50 and older, living with HIV are a growing population with pronounced needs. That population is over 50%. There are some estimates, although questionable, but that number obviously is going to rise. The number of people, LGBTQ plus people, older adults in Illinois continues to grow rapidly. And so as these communities continue to get larger, their needs are there. They have things that we need to address, those disparities that I mentioned. And so what's the issue? Again, people with HIV may need long-term care in an earlier age than those without HIV. So I'm thinking about our dandelions. I'm thinking about all of the entire breadth of HIV, right? And so, again, understanding that long-term care may be needed. And also, when I am thinking long-term care, I am not just talking about in an actual long-term care facility. Again, I am talking about that home and community-based services as well. Obviously, while some older people living with HIV have some social support networks, what we have seen through some work that we have done around policy, that they do need some additional help with meeting their needs for caregiving, social networks, and things of that, as they face the challenges of aging, right? Many people in the HIV space, the LGBTQ space, as you get older, a lot of times we have chosen family that may not be there, that we may no longer be able to count on, and so that presents an issue. The policy report Improving the Lives of LGBTQ Older Adults from 2010, that LGBTQ elders are more likely to be single, childless, estranged from their biological family, relied on families of choice, as I just mentioned. And we would extend that also to HIV older adults as well. And this same community also experience more illness, disability, premature death. Again, this is all from the aging aspect, right? And so they are often afraid to access services because of fear of discriminatory treatment. When we ran a bill, Disrupting Disparities bill, back in 2022, we had a number of people that testified to House and Senate committees that they literally were scared as they were living in nursing homes that they would go back in the closet. And obviously that's no way to live, right? And so because of fear that they're gonna be treated differently. And then again, that bottom part, traditional support systems aren't often in place. And so these communities often end up relying on these nursing homes or other institutions providing long-term care, which gets us to the issue that we're talking about now. So, gotta have some data for you all, always. Data is great. There are more than 2.7 LGBTQ adults ages 50 or older. And here in Illinois, that number is over 122,000 ages 50 and older, making up about 1/4 of the state's a little over 500,000 total LGBTQ adults. Here in HIV, based on the latest numbers from the Illinois Department of Public Health, the number of people living with HIV is about nearly 40,000 people, with an additional estimated about 6,000 who are undiagnosed and don't know their status. And then there's the number of people 50 plus living with HIV in Illinois, ranks about 49% of the total number of Illinoisans living with HIV. So, all of that to say, there's a hell of a lot of people out there that's gonna need our help. That's essential. Anytime that you're working on a policy thought, a policy solution, who are you trying to help? When you're talking about working on a policy, what is the policy, what communities are they trying to help? There's nearly 50% of the total number of Illinoisans living with HIV. That's who it's meant to help. That group of nearly 123,000 LGBTQ older adults here in Illinois, that's what this bill is intended to help. And again, as I mentioned, these numbers are getting larger. That's what we're seeing. The trending is getting larger for these populations. And so we always want to make sure that we are very attuned and keen on who we're helping, right? So what does this mean? What does a long-term care bill of rights look like? Basically what we have seen in states that have already passed this, so states that have already passed this are like New York, New Jersey, if I'm not mistaken, DC has one, Minnesota is currently working on one, Connecticut, and there are a couple of others. Massachusetts, if I'm not mistaken, just passed theirs last year. But essentially what it does is update state and local law. There may be, most of the time, even in Illinois, we're going to be working on this, but even in Illinois, there are pieces of non-discrimination in this piece of law and this piece of law, but rarely do you ever see it all together. So you're having to discern, what does this mean, right? So essentially what it's doing is protecting people from discrimination on the basis of their sexual orientation, gender identity, and HIV status in long-term care settings. So we want to make sure that just because you're gay, you're trans, you're bi, you're a person living with HIV, none of that matters when we're talking about getting the services that people deserve and expect from people who are taking care of them in long-term care settings. This legislation would also mandate LGBTQ plus and HIV cultural competency training directly for long-term care staff. What we were able to do a couple of years ago, we passed legislation that requires LGBTQ plus and HIV cultural competency training for medical providers across the state. This would basically complete that circle that would also include long-term care staff. So when we're thinking about our CNAs, we're thinking about the people that work in nursing homes, that work in hospice care, that work in these places where our communities are getting these services. We want to make sure that the people that are providing these services are attuned to the sensitive needs of our communities. And so an example of that is making it illegal for a long-term care facility to deny admission based on their SOGI, which is sexual orientation, gender identity, or HIV status. Or someone where if someone of trans experience or anyone that wants to use their pronouns, that facility would have to use their preferred pronouns, right? If they would have any other items that makes them sensitive, that would make them feel more comfortable and be able to live in their authentic selves then that Bill of Rights would allow them to be able to do so. So, you may say, why in the world is it needed? Again, as I mentioned, what we are doing is that many of these communities rely on these institutions to provide care, right? If you're in a nursing home, if you're in hospice care, if you're getting home health coming out to your house, you're reliant on these staff to take care of you, to take care of your loved ones, right? And so it's important to make sure that, again, that the people that we're bringing into our lives, whether that be at home or in a long-term care setting, that making sure that they know exactly what they're doing, and again, being attuned to the sensitive needs of our community. The second part, stigma and discrimination is a thing. Specifically, HIV stigma, LGBTQ stigma, homophobia, transphobia are all real. And obviously they will have a tremendous impact on the lives of our communities. And so when I mentioned that when people are in long-term care facilities and we want people to be able to be their authentic selves, that means free from stigma and discrimination. And so that's what that means. So that's another reason why this Bill of Rights is needed. Again, this third point, staff are not always clear on how to provide the appropriate care. So one of the things my mom always told me, don't bring me a problem unless you bring me a solution. So you say you don't know how to do something, we'll tell you what, we're going to train you how to do it. So that's no longer a problem, right? So you will no longer, staff will no longer be able to say, well, I didn't know. Well, we're going to train you how to do it, right? And then again, a clear and established Bill of Rights is a powerful tool for self-advocacy. One of the things, every time I think about this, it reminds me of the Denver Principles. And if I'm sure as an advocate, you think about that, it's such a powerful tool of self-empowerment that we are beyond, we refuse to be called victims and patients, and we are people living with HIV. It's about us taking ownership of who we are. And that's what this Bill of Rights is intended to do too. That we still have rights, that even if we're living in a long-term care facility, that we still have rights, that we're still whole people, and we still deserve to be treated as such. And so that is the reason why this Bill of Rights is needed. So, where we are right now, and this is, if you would like to join the coalition, we have a coalition that of the willing that is growing leaps and bounds. One of the things when we first started having this conversation a couple of years ago, very kind of like early on, I wanted to make sure community was at the heart of it. I can bring in 30 organizations across the state to get involved in this. Easy, I can do that with an email. But I want community to be at the heart of this because that's what's important, right? And so where we are right now, just to kind of get you sped up, I'm not going to go over 2 years what we've been doing. But what we're doing right now with the coalition is our partners at SAGE. SAGE is a national organization working on behalf of older adults, and they specialize in LGBTQ populations, including HIV as well. And so they have, I can't believe that they did it actually, they helped put together our first draft of what legislation could look like. What, I am a registered lobbyist. It takes a long time to draft a bill. So if I can have somebody else do it, that's what I like doing. So they have agreed to pull that legislation together. We already went through the first draft, and we had a great meeting where people were like, yeah, I like this, but don't like this. Can we strike this and put this in? And that's the type of participatory advocacy that I like. So our next meeting is actually this upcoming Tuesday, where we're going to go through the second draft. And so to make sure that we have a draft that's good for community. And then the next couple of steps will be, once you get your draft, then you start talking to opposition, people who are going to potentially oppose this legislation. Obviously, your long-term care providers will probably oppose this legislation. The state medical board will probably oppose this legislation. The hospital association will probably oppose this legislation. But that's a part of the work too. And so we will work with them, we will find sponsors, and hopefully work on running this bill when the General Assembly goes back into session in mid-January. So these are some resources, and I'll make sure that Jeff, please feel free to send this out to everyone. These are just some great tools from SAGE. That Disrupting Disparities report that I mentioned at the outset is very specific to Illinois. So you really want to, that's probably where you want to start. And there's just my information. Very, very quick session. See if y'all have any questions.
Thank you. Thank you. We do have a couple of questions. We're going to take one or two. 1, 2. Okay, and then we're going to bring Carmen up. And afterwards, they're going to stay, right? And we'll be able to have a larger conversation. Thank you. Say your name so he knows who you are.
Hey, Timothy, nice to see ya. Could you do me a favor and go back a couple slides? I think it's 3 slides. You know, and I hear you talk about, you know, in your last comment, one more. All right, I heard you talk about in your last comment. I want to make a comment towards, you know, the legislation, then reaching out to opposition. And you know, really think in this current environment that the opposition doesn't want to work with us. Period. And then when I'm looking at, or one more slide where you're talking about? No, forward. I'm sorry.
Just tell me.
One more. All right, this one. Okay. This one. So you know, when you're talking about that Bill of Rights and legislation, I'm wondering if you could talk a little bit about the difference between state and federal, because when we're looking at these things that you're talking about here are predicated upon protected classes, right? And we know that that's all under attack, and we have a Supreme Court in place that's likely to strike down that kind of stuff. So when I'm thinking about this, I'm thinking about this in terms of state to state, right? Because you may have more states. We're lucky enough to be living in the state of Illinois. We have a great governor. We have a supermajority in our state legislature, right? And so the difference between somebody living in Illinois and somebody living in Missouri might be a little bit different, right? And so how is that gonna work?
Yeah, I think that's a great question. Thank you so much, Brian. Couple of things. Yes. The answer to your question, a couple of things. Yes, it does matter on the federal side what federal courts are doing, what they are choosing to believe in today. They may not be choosing to believe in tomorrow, depending on whatever the judge is.
You all right?
The way that I always look at the difference between federal and state right now is insulate what we're able to do here in Illinois and be very specific about it. Right? Right now, Illinois has something called the Human Rights Act that is, by all means, the standard when it comes to protections for folks. However, the problem with that is it's not very specific. I like specificity in law. And a lot of times it's very broad and it's kind of all over the place. Right now, Illinois has the Illinois Human Rights Act, they have the Illinois Nursing Home Act, Illinois Long-Term Care Act, and there's another one. That they have like pieces of laws for all of this. And so what we're trying to do is put it all under one thing. So there is literally, well, people can go to one law and it's all there, but then there's no having to guess. And again, that's making it easier for people to implement the law. And so that's part of the reason why we're doing it. Is it going to be an uphill? You mentioned something about opponents. When I say opponents, in Springfield, our state capital, there's this thing called no permanent friends, no permanent enemies. Because every agency, every organization down there has its own reason for supporting or opposing whatever legislation. They're trying to protect their people just like we're trying to protect ours, right? And so, just like I called off some of those that I think that we're gonna oppose, I've also worked with some of those same organizations on other pieces of legislation. So, I want to clear that up too, for me saying that.
Okay.
Yep.
So just for clarity, we're talking more about focusing what we're doing here in Illinois as far as the legislation and not on the national.
No, this would only be Illinois. We definitely.
It's called the Illinois Bill of Rights.
Yep.
You are so right, Brian.
Yeah, we believe in federalism around here. Even if the Trump administration does not.
Timothy, thank you very much for bringing that subject to forefront for this conference, because I was first introduced to this when I was at the U.S. AIDS conference in D.C. a couple of weeks ago, and the lady was telling me the states that had already done it, and I was asking her the question, is anyone in Illinois doing it? And she said, yes, they are, Timothy Jackson. I was like, oh my God, I know him. I want to be part of this. So please, I've already filled out the thing, so please let me be part of this and let me learn and grow and give some input on it or whatever, but this is very, very, very good. And I thank you for bringing that to our attention today.
Absolutely. Would love to have you a part of the group.
Yes, and I
I'll try my best
encourage.
to remember to send you the meeting invitation.
Did you tell everybody how to contact you in the event because we talked about calls to action today, did we not?
Absolutely.
This might be one of them.
What did I do with it?
Okay. Yes, please, leave that up there. And I
Yep.
have one more question. We're going to go ahead after everybody speaks, after each speaker speaks it. If you want to ask your question now, I would do that. I'm coming back to you. Let me do here.
All right, good afternoon.
Hey there.
First of all, you know the Ryan White Cab at AFC had its second support group the other day, and one thing that came up that we talked about, and I said I was going to ask you about this, we wanted to know if, you know, when you go down in Springfield and do your advocacy and do your asks and everything, is it any way possible that one of our asks could be, maybe not this year, but maybe next year, that the state gets some money to bring back support groups that are not tied to social cycle objectives, but someplace where clients can come and sit down amongst other clients and talk and get knowledge and maybe advice from other people as to how they handled other difficult situations. Because I know in the beginning there was like support groups everywhere,
Right.
but over time they disappeared and they dried up and they tried to come back, but then they were tied to psychosocial, and most of the times they were trying to push the groups into one specific area. Is this something we could do this year?
I'm going to be honest with you. That one's going to be a bit tough, and this is why. You are looking at, on the federal side, if you're talking specifically support groups for HIV, you're looking on the federal side where they are talking about tremendous cuts to HIV funding, which a lot of it comes to states. Right now, the House and the President have put together budgets that would get rid of Ryan White's parts C, D, and F, completely gut what we're looking at right now. So that's one problem. Another problem is if the state, if the federal government cuts a lot of these things, how does the state then fill the void? And I'm gonna be completely honest with you, Illinois cannot, because they just don't have the money to do so. One of the things, I'm gonna give you some hope, because I'm not gonna do you like that. We are going to be asking for additional money this year, as we do every year, additional money for HIV. What we do through our advocacy is just ask for more money to what we call the HIV lump sum. It's the state's largest pot of money for HIV. Covers everything from PrEP to ADAP to salaries to a little everything. It's about $25.5 million. So we are going to be asking for additional money for that to somewhat kind of balance out if these Medicaid cuts take effect. So there's that. Obviously, they can do whatever they want to do with that money, but there's definitely some room for advocacy to bring back support groups, to bring back a bunch of things that we lost several years ago when the state did not have a budget for 3 years. So, yeah. We can work on it.
There's a lot of work to do.
Yeah, a lot of work.
And we
It's
gonna
called
do
job
it.
security.
And we're gonna have a question about advocacy from
Yep.
Sharon. Go ahead, Sharon.
Yes, my question is about advocacy. I'm seeing that it says contact information. Well, my thing is about advocacy. Every time there's something or resources for people with HIV and AIDS or other services, we have the ones that are big I's and little U's. So what do we do, or how do we address those situations when people lack professional intelligence or emotional intelligence and professional etiquette? Advocacy.
Thank you, honey. Thank you, Sharon. I think,
Yeah, because I'm trying to follow it. Yeah, I apologize for that.
Yes, I said, how do or what do we do about the people that are supposed to be advocacies or the professionalisms, the people that are the employees that lack professional etiquette and emotional intelligence? What do we do in situations such as things that just transpired?
One of the things I would say
Thank you.
is a couple of things. One, I think we're all adults here, right? And excuse my language, shit happens. And so there's a way to agree and to disagree agreeably. And so to be completely honest with you, the way that just transpired shouldn't have happened. It shouldn't have. If we have a grievance with someone, that is something that you take off of the floor and you do that to the side. That can't happen again. That's not placing blame on anybody. That is just being real. That's a part of being an adult. That's not being an HIV advocate. That's being an adult. And so that's what I will leave it as that.
All right, thank you. Carmen, bring it, honey. I know you can. And wait, let me properly introduce Carmen. Everybody know Carmen, right? She is going to talk about relationships. And I'm going to let her define what that means to her. I think it's fascinating. So go ahead.
Hello, everybody. And so when I joined the committee, I heard a word called, we were talking about serial discordant couples, and then I believe it was Ms. Caprice that said the word magnetic. And I looked it up. And so I will be talking about magnetic couples. I thank God for my husband who's in the room. Everybody knows where I go, Nate go. Everywhere I go, Nate is there. He has showed up for me consistently for 14 years of marriage. And so thank you for that. And so the term magnetic in relationships, one partner is HIV and the other person does not have HIV, right? Other terms used was serial discordant or mixed status. And so I just learned maybe a couple of weeks ago how to say serial discordant, right? I couldn't say that word for nothing. It was hard to explain it when you're out in the community, you know, so I'd be like, I got HIV and he don't. And we just left it at that. And so, so I'll give you a little background. In 2009, I met a guy, and I was still using drugs, and I went and hung out with him in his basement apartment, and he got bit by a spider, and I was sobering up. But I knew something in my gut knew that there was something going on with him. And he went to the hospital, arm swelled up real big. He went to the hospital, came back, went to the hospital again, came back, and on that third trip, he went to a clinic where he was case managed. And I went to the clinic with him, then he went to the hospital. In the hospital room, you know, they do your background, your history and stuff. And so the nurse comes in and she says this, do you want her to be in the room? Mind you, I had to help him take his shirt off because his arm was swelled up. She said, well, do you want her in the room with you while we go over your background history? He looked at her and me at the same time. He like, oh, hell no. I'm like, what? Hell no, what's going on? I still couldn't put my finger on it. And so they transferred him over to the emergency room where they was going to admit him. He turns to me. Emergency room was full. It was full. And he turns to me and he says, I deceived you. And I'm like, what is he about to tell me? And he said, I'm HIV positive. And right then and there, I probably turned 3 shades of white right there in that waiting room, right? And I couldn't really respond because it was full and I didn't know how to respond. And so I called somebody else that I had been dealing with, and the next day I went and got tested. I tested negative. But at that time, I knew there was something happening in my body because I was sicker than a dog already. So I began to serial convert, and I'm not going to go into all that. But, and I thought about it, and I thought about this guy, and I thought about it when I began to educate myself and learn about some things. I thought about, well, why wouldn't he tell me? Why wouldn't he tell me what was going on with him to get me? Why he take my choice away? But I always took responsibility on the part I played in it too, right? And so when I thought about it, I thought about him wanting to have human connection. The one thing that we all need is human connection. And it's hard because if I tell you I'm HIV positive, the biggest thing is the rejection outweighs sometimes the telling. Being rejected, again, outweighs you disclosing your status. So a lot of times we don't disclose our status because we don't want to feel that rejection. So we make other unhealthy choices, right? And so that's what happened. Long story short, I started working at Open Door. Years later, this guy was lost to care. He wound up on my list, and in the beginning, he would get on my list, and I'm like, no, I can't deal with him. I can't, I referred him to somebody else. Long story short, I finally reached out to him and gave him a call and said, hey, look, you need to come get into care. This ain't got nothing to do with anything between us. And he's like, he missed his appointment, but he finally showed up. And so I'm walking across the hall. He's coming down the stairs. And as he's coming down the stairs, he stopped me in the hallway. And I thought I had dealt with a lot of this. And he stopped me in the hallway. And maybe 12 years in, no, it was probably 10 years in before I started working in Chicago. He said this to me. He said, would you forgive me? And that process had already happened. But for him to have the opportunity for himself to say that was huge. Shortly after that, we tried to get him some housing. He was on a list to get some housing, but he passed away before he was able to. He got in the program, but he didn't live to see himself get the housing. And so that's a long story short. How I met my husband. And while we're here, I'm talking about magnetic relationships. And this is my boo-hoo, my Amia Mori, right? And so I was leaving the clinic, leaving a doctor's appointment, and he'll tell it a whole nother way. Y'all might want to give him a mic. But I was leaving a doctor's appointment, and there's a hill in the road, and I was walking down the hill. As he's coming up the hill, he's got on this suit. Was it powder blue? Navy blue. Okay, I say powder blue, he say navy blue. And he had on cowboy boots. Now, mind you, these cowboy boots, I said, what's going on with this character? And the boots was kind of scraping the concrete. And so I noticed they had some spurs. They had some spurs on the back. I'm like, oh, are you serious? I'm like, are you serious? And so I'm incognito because I'm hiding from some stuff that I had not settled yet from coming off the streets. When you're robbing dope dealers and living that life, you can't just take off everything once. So I had to go through Midtown, what they called it. So I'm incognito. I had on a hoodie, tied up. Anyway, and so when he walked past, some say, do not look at him. Don't turn around and look at him. And what did I do? And he was standing right there. He's like, hey, what's your name? And I gave my name. Come to find out, he was already going to the ministry that I belonged to. But I hadn't got back to church yet. But he had joined the ministry. And so I started going to church, hadn't put two and two together yet. Can't make this long story short. We started sneaking around in the church. You know how people don't want to sneak around in church. But I remember my first date with him. And I caught the bus downtown, and I had him meet me downtown. And he's like, where are you going? I said, I'm going to the doctor. Because this is where you can get out. This is where you got your opportunity to go ahead and go. And so he met me downtown, and I said, I got a doctor's appointment. He's where at? I said, at Open Door. He said, why? I said, I'm HIV positive, thinking that he was going to take off running or something to that nature. He said, okay, let's go. Let's go. Okay. And that began our relationship. And just in that, I was able to, we had long conversations, and he asked a whole bunch of questions, and we talked. And when he asked me to marry him, I didn't know, because in my mind, we was just friends. We was, and I was attracted to him. I ain't gonna lie, after I figured out, he always dressed nice, and I'm thinking, man, that's do he dress like this every day? What's wrong? But anyway, he always dressed, he's shaking his head, yes. But when he asked me to marry him, I'm like, wait a minute. Well, what's going on here? I said, yeah. I heard him say, yeah, just in case you want to allow him to lock it in so he'll change his mind. But I realized one thing about magnetic relationships. Since one person is positive, the other person is negative. But when it comes to relationships, it's not always easy. My husband is not responsible for me taking care of myself and having HIV, right? He is the support, but he doesn't You know, when you go into a relationship, you have to be a whole person. This is what I found out. I don't care what relationship you go into. You have to be a whole person. If you got issues, it's good to be in counseling while you're dating. Why? When you're in counseling, you can channel that stuff through your counselor. You don't have to channel that stuff to the person you're dating. And so for me, I had to learn that too, because oftentimes when you get in a relationship, you want to dump. You want to dump on your partner. You want him, I wanted him to fix me, and he couldn't fix me, nor could he take away my HIV. You know, and then we often look at the person who's living with HIV needing all the support in the relationship, and it kind of makes the relationship one-sided. What about the support for the person who's with the person who's HIV negative? What about their support? How are we showing up for them? Me, I'm a public speaker. How does that impact my husband sometimes when he's out by himself? Well, people wonder, is he HIV positive too? Right? Because a lot of times you'll hear, well, he had to be positive. He married her. But that's not the case. So how do I show up for Nate when these things come up? You know, and we process that. Going to the doctor, changing medication, and having these discussions about medication. We know scientific facts say you equals you, meaning that undetectable means untransmittable. But in a relationship, you have to have that conversation and give your partner the opportunity to get on PrEP. Learn about PrEP. If you get into a relationship, learn about PrEP. Give them that choice. If you're dating, give them that choice. You know, my husband chose not to get on PrEP, and it talks about intimacy, and we all good. I got a smile on my face, right? Even at 50, you know. But the thing is that I think with intimacy and dating and relationships, when one person is positive and one person is negative, when we think of magnetic, that magnet's got to stick and it's got to work, right? And so just showing that person support. I'm a mother of 9. I'm 17 grandchildren and counting. Me and my husband, we also work in the community. He is an assistant pastor of a church. We do a lot of stuff in the community as well. I think one of the biggest things is when he shows up, he's real observant. And Nate, wherever we go, he's real observant of the room. And I appreciate him. And we bounce a lot of things off of each other. It's easier to talk in this setting because a lot of people in the room here are positive or know somebody's positive or been in a relationship, you know, whatever. When it gets to the church and I begin to talk about serial discord, well, magnetic relationships, because I have to in the church. I have a charge and a command. I have to talk about this in the church. I can't get around it. He watches, and he watches how people respond to me. And in the beginning, he would get a little frustrated. But for me, it was okay. Because at least I'm getting information out there. And if Granny ain't getting none, that's fine. But she might be able to take this valid information home to one of her grandchildren, right? Or be able to point them in the right direction. I went off on a tangent. Conversation. Did I cover everything? I talked about you is you. I talked about PrEP.
How do you talk more about this relationship?
My relationship.
Yes, ma'am.
I love him. Trouble. When we have had arguments, and we have had arguments, I think there's a thing with fair fight. Now, he doesn't mention HIV, nor does he mention the fact that he married me with HIV. But if I'm feeling some type of kind of way, I might throw that out there. Is that fair to him? No, it's not fair to him. It's not fair at all. Why would I bring that up as even leverage or mercy in the relationship? And so when it comes to relationships, we have to fight fair. And like I said, we have to know who we are, you know, and be whole and complete, or at least be working towards being whole and complete. Thank you.
And I'm hoping that we didn't miss a lot of you, because I reportedly was standing right in front of the camera when you were talking. But I think she got what she needed.
So, I really don't know what else to say. All my children, all my adult children know that I'm HIV positive. Where we go, they know that Nate is HIV negative. Most of his family knows. I've disclosed my status to most of his family. All my family knows. And Yeah, that's that. I don't know what else I could add at this point.
No, we're gonna take one or two comments.
One or two comments,
So I want
okay.
you just to,
Breathe.
yeah.
Okay. I'm good
Okay.
now.
So Carmen, thank you so much. You're welcome. Especially with the magnetic conversation. Two things I want to know. So for folks who are in magnetic relationships, and one is undetectable, is the other part, is it suggested the other partner gets on PrEP even during the undetectable status of that relationship, or is it y'all just go for what you? I'm just kind of curious how that works.
And so, I did mention, and I believe that conversation has to be had. And if the science is true, and we know you equals you, then you want to give your partner the choice. And so you have that conversation. You give them the option of getting on PrEP or taking a shot, which is Cab and Newborn, and or not using protection. But that person has got to be solid in who they are. You know, you lay down, and you got to be able to lay down with no fear, right? And so if that person is on their medication, their viral load is undetectable, if that person is in love and they choose to go have intimacy, I was about to say something way over there, have intimacy with the other person, and that's on them, no judgment. But at the same time, if you're with somebody and they choose to go on PrEP, don't get offended by it, right? Don't take that so personal. If they choose to get on PrEP, let them get on PrEP. It's not a knock against you. They're just trying to be where they can be intimate with you and remove the fear, so to speak. Did I answer your question? Yes.
You sure did, and we have one more, and then we're gonna give the mic to Nate.
Okay.
Yeah.
I would like to say to Carmen, thank you so much for sharing your story with us. Thank you to your husband for being a part of your life. Because for me, I was afraid to be in a relationship because I was positive. So when I asked for intimacy, I asked for someone who was always positive, just like myself, because I didn't want the rejection or the fear. And it's just a great thing to know that we have allies like your husband. You know, it's great. Thank you so much. Thank you so much. It's real. We can love with HIV. We can be in relationships, and women can have babies because of the knowledge and the PrEP. That wasn't available when I was diagnosed. I didn't even know what PrEP and prevention was. So I'm grateful for you and being so open. When I met you, we part of the CAPS together. You was online, then I met you in person, now I'm seeing you again. Thank you, and you're someone I need to connect with and be around. And thank you, husband. That's our husband together. Thank you.
You say that. You say it. Mr. Nate.
Hi, my name is Nathaniel. I'm Carmen's husband. Everybody know. I'm also a pastor, and I am not on PrEP because the first person that she became an advocate for was me. When I went to the doctor with her, she let me know that she was sincere about, me knowing her status and being educated about her status. And I just want to say, baby, I am so proud of you. I watch you blossom into this advocacy, this person who care about other people's well-being before your own, And I thank God for every opportunity that the agencies that she had worked for had allowed me to, go with her and be educated in the rooms with her and, learn about her, her disease that she has, but at the same time, we got prayer, and we trust God, and we know that God is bigger than anything in this world today. And the key thing is, having a relationship with God, and having a heart to see other people, lives change like hers has changed. Her life has changed tremendously. And I know that God played a big part in that, and also bringing me into her life. He played a big part in both our lives, because I was doing things, I could have been affected myself. I wasn't always no saint of God, trust me. I sold drugs and I used drugs. I just didn't, yeah, and that too. I was, yeah. I ain't gonna say that word, but yeah, I was. I was very promiscuous. You know, it was only by the grace of God that I didn't come up, you know what I'm saying, with a status myself. You know, and I thank God for that. And partnering with her and being able to be educated about this, you know what I'm saying, it helped me along in my journey, you know what I'm saying, to help change my life to fit her life, you know what I'm saying, to become an advocacy with her to change, you know what I'm saying, and the Lord, the status results, you know, and I just thank God for you, baby. Keep on doing what you're doing and keep on trusting God.
This ain't over yet.
I just want to
Carmen,
say,
this ain't over
can
yet.
I say one thing? Just one thing. Nate has, I'm his wife, but Nate has a bunch of wives in the room. Ain't that right, Miss Judy?
Oh, well, raise your hands.
They got a few wives.
Okay.
A lot of them claim them, and it's just so cute.
Oh, I
because
just
it's just
claimed
sweet.
Wahida and her husband.
Right.
So I understand. Wait a minute now. Wait a minute. Nathaniel, could you do me a favor? Could you just go up to the front with her, please? And then we want to give them a round of love and just wonderful. All right. Thank you. That's beautiful. That's beautiful. Wait, we got some pictures. See? Oh, looky. So Philadelphia got Wahida and Eddie, and Chicago got Nathaniel and Carmen. Oh, this is a movement, y'all. All right, thank you, you all. Thank you. You want to say one last thing before I close out? Who has a hand up? Brian. Oh, you did? No, Brian. Brian has talked already. Brian, you gonna give the phone up? Okay.
I just wanted to say, Carmen, I love you so much. It's so much joy and inspiration that comes from you. And seeing you and your husband, I pray to God one day that I'll be blessed with the love that you have with your husband. I just love you, and you're just a great, amazing woman. You're really an angel. You really are. And I wanted to thank you for last summer, our trip.
Oh, yeah.
Thank you, and I love you.
Hey, I appreciate that. We have one more, but before we let Reverend talk, I want to just make the announcement. We're going to have the cookies as you're leaving. That's your, okay? We're not having them right now. That's right. We're going to let Wahida do her thing, and then when you leave, and just edge your way over there to the cookie. That's sure enough, because it was a fight up in here. So Carmen, you want to have last word, or you okay?
No, I'm okay. I'm just really grateful to be here. If you're considering getting in a relationship and or in a relationship, do it with the assistance of some counseling. Connect with somebody that you can bounce some things off of. You know, during the dating phase, during the move-in phase, you want to be running that past somebody. You want to be a healthy person. You want that person to be healthy as well, and so that's all I have. Thank you.
Everybody
thank
give her
you, Jeff.
love. Thank you, Carmen. You did excellent. Excellent.